Hi there, this is Dr. Nicole Anderson, and I'm here to show you how to release fascia, myofascia, muscle, and fascia, connective tissue is another word for fascia, that will help relieve knee pain. So if you're having pain on the outside of your knee, or if you're getting pain on the inside of your knee, this will help you. So you're going to use your you're going to get a maxi ball. It's a soft rubber ball. It's made by OPTP, and a soft ball is much better than a hard ball for this technique. So what we're going to do, some circles on your inner thigh. Okay, and we're just exploring the tissue first. We're just trying to see if there's any areas that feel sore, lumpy, bumpy. Okay, and then if I find an area that feels sore, lumpy, or bumpy, then I'm going to go up and down, side to side a little bit more right in that area and kind of push a little harder. Right, so we're looking for pressure that feels firm, maybe a little bit uncomfortable, but kind of comfortably uncomfortable. Nothing that's making you white knuckle it to get through it. Because if you're white knuckling it to get through it, if it's really painful, then that triggers a whole cascade of hormones and nervous system responses that actually cause more tension. You might get a temporary release because you're going to get endorphins releasing. Those are your feel-good chemicals inside of you, making you feel good after a painful technique. But it's not going to give you a permanent release in the tissue because it's going to actually cause you to tighten up. So we're using a soft ball and we're using a little more gentle techniques, which I've found are actually more effective. All right, so I have a little more soreness right down here closer to my knee, so I'm doing some more up and down, side to side right in that area. And the idea is we're trying to fluff and buff the fascia. We're not trying to blast it, punch it, push really, really hard. The fluffing and buffing stimulates glycosaminoglycans and fibroblasts, which I talked about in other video clips. And what that does is it stimulates fluid coming into the fascia so it can slide and glide. Really important. So this will actually help, doing this technique here is actually going to help you more for IT band friction syndrome, pain on the outside of the knee, than doing anything out here on the side. Okay, so keep that in mind. We want to loosen this area up because that's going to take pressure off of this side. The reason for that is because if you're tight here, what's going to happen is it's going to pull your femur, which is your thigh bone, inward like this, right? And then that puts tension on the IT band, so it's taut, not tight. So people think, oh, I need to stretch my IT band because I have pain out here near the IT band, or if I have IT band friction syndrome because I need to stretch it. Well, most of the time it's actually because of tightness here and weakness up here in the lateral glutes. All right, so we need to strengthen the lateral glutes. We need to loosen up the inner thigh. So I just showed you how to loosen up the inner thigh. And if you have questions about anything else you can do to help you with knee pain, then reach out to us at the clinic and we'd be happy to help.